Congressman Arrington met with leaders from Covenant Health today about vaccine distribution and health care legislation. And KAMC Amy Koczera was there today as well.
Brian, Congressman Arrington talking with Covenant Health leaders about how health care reform passed at the end of last year will help our rural communities continue fighting this pandemic and addressing the specific needs of their communities without having to adhere to costly government mandates.
Rural health care was experiencing a crisis before COVID. 40% of rural providers were operating at a net loss.
Arrington emphasizing the struggles our rural hospitals faced even before COVID, but thanks to legislation passed in the last session, we're already on the path to improvement.
We've got to do structural reforms long term. We can't just have the temporary targeted relief and assistance because they were in trouble before COVID. One of the things that passed was what we call Save Rural Communities Act. And it's a payment system reform.
Allowing rural hospitals, often with fewer patients and less taxpayer revenue, to opt out of costly government mandates that require fixed costs for inpatient resources.
This payment system basically repeals those mandates and gives discretion, flexibility, and freedom for these groups to choose how best to serve their community.
Arrington also received a tour of Covenant's vaccine distribution center and met with frontline workers to hear firsthand what fighting a pandemic is like. Meeting with leaders from hospitals in Lubbock and rural areas like Levelland, Plainview, and Hobbs to explain how this reform will help.
We believe that we're feeding and clothing America and fueling America's economy and giving us energy independence. Guess what? You got to have some critical infrastructure that's sustainable. I think we went a long way to make that.
Arrington also helped pass reform that will save rural hospitals money, ensure better care, and reduce drug costs for seniors. This will help all of our rural communities be better prepared to deliver vaccines and continue fighting the pandemic.